So now we're recording. So hi, welcome everybody who's joining us here, and welcome Robin. This is an exciting moment because this is our first live blab about psychologically informed environments. So I'll just do a brief introduction. I'm Ray Middleton, a system broker from Fulfilling Lives in Newcastle and Gateshead, and I work for a mental health concern and Fulfilling Lives. And we work with over 100 people with multiple complex needs across Newcastle and Gateshead. But part of our job is also system change. So we're launching this live TV program today, and we're going to do a regular one focusing on psychologically informed environments, which we're going to get on to talk about, and interact with the audience as well. And over time, we'll do a regular one once a week, before and after Christmas as well. And that will allow us to build up an audience about sharing ideas and hearing what you think and exchanging views. What we're going to focus on for the next few weeks is psychologically informed environments and being useful to yourselves as the audience about sharing information about that. And so I'd like to introduce Robin, or ask Robin to introduce himself and say a little bit about yourself, Robin.
Okay. Just checking the sound is okay.
It seems fine to me, yeah.
Okay. I'm Robin Johnson. I years and years and years working in mental health, community mental health. Got particularly interested in housing and homelessness about 5, 10, 15 years or so, I guess, ago. Ended up coming up with this term, psychologically informed environments, as a way to try and describe what I and a few others saw as being a lot of really exciting creative work that's done in homelessness services, in working with people with very complex needs. Well, in the mental health services, we used to call it personality disorder, but I think we prefer the term trauma or complex trauma these days. And I've now become, I guess, one of the kind of spokespersons for this development. It's become a kind of movement almost, really, as people start to get the idea of, this is actually what we're doing, and it's exciting, and it's worth sharing. And so I run a website. I've written various different papers and academic journals, and was editor and so on for a journal. But mainly what I'm trying to do at the moment is use this really exciting new media stuff, the way we can use video, and we all use email. Yep. But this kind of stuff, where we can actually talk to each other, breaks down those. I mean, you're up in Newcastle, Gateshead. I'm down in Cornwall. Yeah, we're opposite ends of the country, and yet we can talk as if we were in the same room.
It's very, very exciting, isn't it? And build up a wider community of people interested in, particularly helping homeless services to get better and develop around how they work is psychologically informed environments, or accommodation-based services, people who reach people on the outskirts of society who often end up in homeless services. They're out. So, hi, I wanted to welcome Jamie on.
Hi there, can you hear me?
Yes. Yeah.
That's amazing. I've never done this before, and I'm fairly new to Twitter, so I'm just
well done.
Really
well
grateful.
Done. Congratulations
for introducing me to this.
I should say, he's not just you. He phoned me up 10 minutes before this thing started, and he'd never heard of Blab, he'd never heard of Periscope, he'd never heard of any of it.
Wow, that's amazing.
Log in. I'll bet you'll find it easy to join in.
What we should do now then, we should what they call prop bomb Jamie, which means if you're there and you can click on Jamie and these little hands that come up go.
Hi.
Blabtastic, man.
So can I ask Robin a question?
Yeah, sure.
I was trying to type it in. Can you see what I've typed in? No.
No.
No, I obviously haven't done it right. I'll learn. So what I'm struggling with in Bristol is how we bring statutory mental health services, CAMS and adult mental health services, in a systematic way with homelessness services, so they kind of form part of the pie, because currently they tend to operate at quite a distance. And you know, if they can, an example would be a psychiatrist or psychologist assisting in the formulation for a young person that's got a very complex trauma history, to join in with the home service, not necessarily providing ongoing therapeutic support, but just looking at the case history and trying to really sequence our interventions with the needs of the young person in terms of what's happened in the past. So just whether there are examples of cities where mental health services actually join together with homelessness services to actually form part of the experience that the person has.
Yeah. Firstly, let me always say, I'm not the expert on this. I just pass on what I hear from other places. Secondly, yes, if you want to go down the sort of good practice examples route, then we can look at a lot of places. We can find examples of places where you have got psychologists, psychiatrists, GPs, nurses, occupational therapists involved in supporting the work of the homelessness service. So if pointing to other examples would be effective, then that's one way of doing it. But the other thing that I think is always seriously worth considering is talking to the commissioners of services.
Yeah,
because they are the ones that hold the purse strings.
Yes, but we invited the CAMS commissioners to, they came and met the services on Monday, actually, because they're recommissioning CAMS in Bristol.
Yep.
And we're trying, but I get a sense, particularly when you're working with young people, it's very hard because of the split in commissioning between children's and adult services. It gets very hard to get anyone to really commit in a meaningful way to working with, for example, getting CAMS to work with 16, 17-year-olds in a meaningful way.
Yeah, if I could maybe be helpful there as well, there's a couple of ideas come to mind. One is it'd be worth getting hold of the Westminster City Council have just come out with some PI guidance. So one of the things we've done here in Newcastle and Gateshead is that's going to be published on the 27th of November. But I put my email into the feed here, or it's ray.middleton@fulfillinglives-ng.org.uk, the world's longest email. But anyway, if you email me, or I'll catch you.
Brilliant.
Basically, we'll get you the link, get you a copy of that. It's a short, very well written document, but because it's been commissioned by Westminster City Council, by emailing that, I've emailed that to some mental health people here in Newcastle and Gateshead. Yeah. It helps that relationship to build, because they can see, well, here's a document that's from Westminster City Council, summing up very quickly what a PI is in 5 or 6 clear pages. There's references to about 9, 10, 11 places that have successfully introduced PI in the reference section of that document as well. And that way, it helps people to see the relevance. So that's one thing you could do, is kind of send them that document and kind of so they can link health and housing together, mental health and housing. Yeah. The other things to maybe mention would be there's a memorandum of understanding has been signed between health and housing at a government level. And that's saying that what we need, the government is saying we need to integrate health and housing. That's both mental health and physical health with housing. And there's a big push to get innovation to integrate those two things, and in terms of reducing health inequalities. So that's because that's a top-down government document. By referencing that, people then start to see themselves in a context of their commissioners, and they think, so whether you're from mental health or the council and housing, you can think, actually, there's a big push for innovation. PI's an innovation. It brings mental health and housing together. It's in the context of this top-down. Here's the document PI guidance. Is this helpful in terms of trying to be helpful and valuable to you, Jamie, about a bit of the context, which can help that relationship build on a one-to-one with people visiting your service and talking to CAMS? And that strategically, those things may help you move the service on in the way you'd like to.
So if we're looking for examples, yes, there are a number of examples I know of services that actually do have quite strong involvement from CAMS. I'm trying to get a video. I've got a video of an interview I did with a service in North London. I'm just waiting for that to be cleared by their senior management before I can post it on the PI link. But I can tell you about it, and you could actually give them and so on. As well as the Creating a Psychologically Informed Environment document that Westminster commissioned, there's an absolutely wonderful video that the Commissioner for Rough Sleeper Services did. Her name is Victoria Asirvatam, and she produced a little video that was just an interview, just me holding the camera and her talking to the screen.
It's a great video.
Lovely one, but it's really, really clear on how services can. And so she goes for low-cost things that hardly cost anything, as well as expensive ones. But the other thing that's worth mentioning as well is to talk to people in public health. Well, as commissioners of mental health services, we're often talking about people who aren't in mental health services. They aren't even sometimes in primary care services. And although public health budgets have been really, really hit badly in the latest round of cuts, that's actually because they haven't got much money of their own. The way that public health can start delivering more preventive services is by talking with the people who do commission services and making sure they cover those gaps. Certainly Public Health England and Public Health Scotland are getting very, very interested in homelessness and mental health issues in homelessness and trying to get a better join up there. So it's probably worth trying to talk to your public health people.
Definitely. And just
that gap between adolescents and adults is really a commissioning created problem. That's not a problem of the individuals.
Absolutely.
That's not the complexity of the individual's needs. That's because the services have been set up too rigid. Likewise, drug and alcohol and mental health. You know, how many times do you hear people say, oh, drug and alcohol said he's got a mental health problem, we've got to sort that out first. The mental health services say you've got a drug and alcohol problem. Those are problems that
dual diagnosis problems.
Yeah. And that's where a lot of the stuff that Ray's doing, Ray and his team up in Newcastle, I've got a video coming out that uses that snakes and ladders image. But it would also probably, in Bristol particularly, it might be worth talking to the Fulfilling Lives Complex Needs program. Because although youngsters aren't necessarily mainstream in that, youngsters grow up and they in a couple of years' time they will be. So there's no reason why that program can't be looking at preventive work, which is really what in effect you're doing.
And we are lucky in Bristol in that we provide a member of staff for youth transitions within the Fulfilling Lives, so we were able to build that into the program in Bristol.
That's great. The other thing, just to mention. Oh, sorry, go on. I was just thinking. Go on, Robin.
If it's not working as well as you'd like, you should put that message there. Well, you're trying to work with the mental health services, and you just need them to respond more proactively.
And I just wanted to pick up on what Robin was saying there about the different strands. In terms of public health, I had a really good chat with Jill Leng, who's the housing lead for Public Health England nationally. And she's agreed to come on to Blab to kind of have a chat, which should be exciting. So if we start to bring some of these key people in terms of system change on to answer your questions, it might help to link up those bits of the system where there's a lot of goodwill in different bits of the system to do with housing and health and other bits, addiction services, but often they don't connect well. So I think Blab, as a live streaming kind of new social media, has the ability to connect people quite quickly. So we've got Jill on and we've got some other people on. We could answer questions like you've brought, Jamie, but actually get people to give you a direct answer, as it were, and to generate different ideas. It's quite exciting, I think.
Yeah.
Oh, one other thing that's worth considering as well. The homelessness and healthcare inclusion, the faculty of homelessness and healthcare inclusion. I've been to a couple of their conferences. There's another one coming up in March next year. They've had a few practical difficulties in the last little while with some of their team. But they are very much focused on influencing what health does and how on the ball, how proactive the health service is about recognizing that these are major, serious needs that you need to concentrate, to focus on. So you could see whether or not there's, I'll tell you what, we can ask, a couple of people I know are part of the planning committee, and we can see to what extent they're actually making youth work, preventive work in youth, part of the programme. If not, we should be suggesting they do that for next year.
Great.
Has this been helpful, Jamie, to you in terms of a unique
I've broken the dialogue on how on that journey to creating a pie, which I find fascinating and also reassuring. But yeah.
And I think it's worth holding on to that metaphor of a journey, because one of the things I'm into is this thing called open dialogue, which comes from Western Lapland, and it's the idea that we could go on a journey together towards this the pie, and it's not like a switch that's on or off, and then we can help each other, a bit like, have you seen the movie The Hobbit? We can all be like elves and hobbits and dwarves. I don't know. Anyway, we're on an adventure journey together. We can help each other out, Jamie and Robin.
We can work some magic together, couldn't we? I think the system needs it.
a bit of sprinkle the magic blab pixie dust on there, and the pie pixie dust.
And this kind of joining up between us, like hearing what's going on in different areas. So you can say, look, they're doing this in Gateshead. Yeah. They're doing this in Westminster. They're doing this in Brighton. They're doing this in Birmingham. Why aren't we doing it here?
So can I say one thing we are managing to do in terms of you, because it sounds all bad, but we have managed to we've got CAMS, adult mental health services across statutory and voluntary sector to meet every 2 months together.
Great.
And which is really positive. And we set aside half of each meeting to bringing stuck and stubborn cases. So that rather than trying to, there's the commissioning, but then there's working within the resources we've got. And everyone in that room is so committed to doing absolutely anything they can to shift the case or to improve outcomes for young people. So I think that's almost at the delivery level. But when it comes to trying to shift commissioning, when adult services have already been commissioned, children's commission services are being commissioned, no one will put money into kind of a joint transition service because of the mismatch in commissioning cycles. It's frustrating at the systems level.
I appreciate what you say. Yeah, what I was thinking was that might be then a topic for a future blab. We may get some commissioners on, we might get Victoria on, or and to actually have a specific topic if that's going to be helpful, and then people can know a couple of weeks in advance that we're going to kind of talk about commissioning, and then we might talk about other things like frameworks, and we might have a topic of that, so we can be genuinely interactive with the audience about what people would find most helpful to add value to what you're trying to do. So Jamie, could you just what they call in social media a shout out? What's the service called that you're involved with?
The organisation 1625 Independent People.
Because we want to give a shout out to you. You've been brave. You've come on, and it's great to hear you. So, what we can do next time, we're on a link. You could have a link to your website, and you could put it into. There's somewhere on your screen. It might say post a comment, and although you could do a question or a comment, you could also put the website in there, and that's letting everybody else know that. So we could give a shout out to the good work you're doing. Sounds really exciting and positive. Some of the stuff bringing people together, and also some of the frustrations about future commissioning. So we're giving you a shout out there, but also kind of helping people to see that you can put links in the comments when people watch the recording, and I'll send you a recording and you can send it to someone else if it's worked, let's hope. And then it helps people to connect with those people who are interested in each other.
Right.
And I have, talking about shouting out and sort of examples of good practice and so on, I happen to know that 1625 Independent People won an award quite recently, didn't you?
We did, with everyone's support in the public for we won with.
Go on, tell us about it.
Well, it's an award for the best charity project in the UK, and it was amazing. For that
major props to Jamie there.
What's that? And it was it's the staff and the young people that do it, and what they do is they work with the project called Future for Me. It works with young people leaving care local authority care that no one else can really engage with. So the most kind of challenging young people in the care system, plus those leaving custody, those leaving young offender institutions. So they're young people that, what's common is that they've experienced very complex trauma and disrupted attachments in their lives. And then as a result, they present a lot of challenges to services.
Right. That's great, isn't it? And it's good. And that's a way that we could, on the blab, is to kind of give a bit of a shout out to different people, different organisations, and let people know about what you're doing about. Because then people can watch the video. We're already today. It's been very exciting because we started off having a bit of a general chat about pie, but then we've got into the nitty gritty about. How do you communicate with commissioners? How do you bring mental health like CAMS together with those? And that's really a way I'm hoping these blabs around system change can develop, because we can take some of the ideas and invite commissioners on, or take some of the ideas, invite people on about different topics, and it can grow in a kind of in a way like open dialogue, which is listening to what people say and then responding by the next blab, changing the topic of it.
I can see specialist topic areas like working with women, street, for example. I know a number of really exciting, interesting projects working with that particular population. Youth, aging. There's a whole range of specialist client group focused discussions we could have, just as we could look at using the built environment, staff training, learning from each other, particularly getting the health involved. We're going to have to wind up because we originally half an hour. I just want to have a quick return to Richie C, who as a way of asking good questions, Richie. Thoughts about work that could be done with a pre-direct access hostel, no frills accommodation, a pre-pie. I'm not quite sure, Richie, what you mean by pre-direct access. To me, direct access is where people walking off the street and you don't know them. So prior to that, you've got a lot of work on engaging people in street outreach. So if outreach is what you're talking about, if that's what you mean, then yes, we very much have the same ideas, the same thinking. There's a chap over in the States called Jay Levy who's written a couple of books on pre-treatment, which is all about the skills of engaging people before they've even walked in through the door. But they're actually the same skills as you use when people have walked in through the door. So it's not like there's a different skill set. So I'm not sure I would call that a pre-pie model. I think that's a psychologically informed service as well. I don't see that one's more prior than the other, if you see what I mean.
I appreciate what you say there about it's actually whatever type of service is engaging with the very difficult to engage group of people with multiple complex needs, complex trauma or multiple needs. The more they can help them to reflect and become psychologically informed, trauma informed, the better, because those relationships will be better, less wear and tear. So it could be a street outreach service becomes more of a pie, or it could be a building-based service, or as we did in Gateshead, it's not accommodation, but it's a drop-in service for the homeless during the day, and that becomes more psychologically informed. So I think
the relationships, not the building.
Yeah, it's about the relationships, and that our relationships are the container, as it were, the therapeutic potential, or the potential to help people to get better. I'm thinking it would probably be good for us to kind of maybe start to wrap up now. I'll just remind people that you can click on people and follow them. So I've just clicked on Jamie's profile and I've clicked follow, and that way you can work out to start to follow people on Blab, and you can follow people in the feed. And we're going to do another Blab on system change on Pi, same time, same place next week. So Thursday at 12. Tune in then. And then after that, it's going to be on a Friday at 12. But next week, it's Thursday at 12. So you could tell people, tweet about it. But it's been really exciting today. And thanks for everyone that commented from various places like Japan, etc. And everyone who's come on. And Jamie, thank you for coming on. Final thoughts from Jamie and then from Robin, and then we'll close up.
Well, I'm just, Robin's a very humble guy, but he's taught me so much, and we've really shaped our organisation around, building hugely, firstly, on what the staff already do. And I think what I've really learned is how important for anyone introducing a PI framework, is how much you actually have to start by really recognizing and acknowledging how much of this stuff they already do. But Robin, otherwise you'll fail.
Yeah.
You won't fail, but it'll be a harder journey. You really have to recognize that a lot of these things are just common sense stuff that we already do, showing empathy, listening, using relationships as a tool for change. But Robin's taught me so much. He's very humble, but he's amazing. And he's provided a framework for me. The way I see it is it's the relationships that are the tool for change. And what he's helped us to do is develop a framework that supports those relationships, supports the challenges of engaging people that have experienced trauma, the ability to sustain relationships and continue that trust. And the real challenge for me is, how do we use relationships as a tool to avoid dependency, but to allow people to use that, then the redeeming relationships that they develop, as a way of developing new relationships in the community. But so grateful for what Robin's taught us. He's amazing.
That's great, Jamie. I'm really hoping I pressed record, because that was really inspiring what you said there. And what it made me thought about is, when there's an election on and there's that phrase came out saying, well, it's the economy, stupid, which was the phrase saying, like, actually, if you can get the economy right, that's what people. And actually, in terms of meeting people's needs, multiple complex needs, the phrase that came to mind was, it's the relationship, stupid, because, to paraphrase that idea, it's all about relationships, isn't it? Whether you're trying to build relationships with the clients on the front line, with your staff team to be more healing and therapeutic, empathetic towards each other's reactions with managers and with commissioners. It's the relationship.
Totally.
So that's very inspiring. Final thoughts from Robin? Any takeaways from today?
Quickly, just to say that I've also learned an awful lot from 1625 independent people. Some other time, I want to get you talking about your peer mentoring stuff, because I thought that was really, really emotionally intelligent work in working with where young people are at. No, the only thing I would take away really is that I think this kind of, that we've still got a lot of learning how to make it work, but this blab technology, which allows 3 or 4, you know, we've got an open seat still. This is, to my mind, this has got a lot of potential for getting people talking to each other, sharing practice, learning from each other. Maybe we could get, maybe sometime in the new year, say, I'm not going to rush you. Maybe sometime in the new year. Yes, we should definitely have something about youth work. I think we should have something about outreach work and pre-treatment. I think we should have something about working specifically with women.
Yeah.
And that's just to get us started. What else was I going to say? Never mind. That'll do. It just seems to me that to be a bit more topic focused is one of the next things. But Ray, mention your series that you're running up in Newcastle Gateshead.
Oh, yeah.
Lab thing, because that's something we should start telling people about.
Yep. So I'm going to be offering some training around PI, psychologically informed environments, which is there's a cost to it, which is £35 per person, but anyone can email me if you're interested in it. But we're going to do it in an interesting way, which is via Periscope, half an hour a week in January for 5 weeks. And we're going to put a lot of the content together in these, and then we're going to record the Periscope, which is live technology, but we're going to make the recordings available to anyone that signs up to it. And that way you'll have 2.5 hours of really good quality PI information in things that staff can watch over and over again. So if anyone's interested in that, do email me. And we're going to do that through Fulfilling Lives here up in Newcastle Gateshead. And excitingly, you know, we're going to do more of these blabs. So invite people to sign up to Twitter blab at dialogical_Ray. Okay, catch you later. Thanks, everybody.
Cheers, folks. See you.
See ya.